What's going on, guys? It's Mike Taylor, student physical therapist, coming at you today. It's St. Patrick's Day. I'm in my garage. It's a beautiful day outside. I'm going to talk to you today about hip pain. This is something that I see a lot of strength athletes that I follow both on social media and in person complain of. Also, some patients that I see in my own clinic, a lot of runners and cyclists, will complain of pain kind of on the outside of their hip right here. And what they'll say is that a lot of times the pain will increase at one particular point when they're going through a cycle of hip flexion or extension. And then also they'll say it will hurt when they push on it or some of the surrounding tissues as well. So one possible diagnosis that we could be working with here is what's called greater trochanteric pain syndrome. And basically what that refers to is any number of different pathologies that all refer to pain centralized around this area, your greater trochanter, that bony notch on the outside of your femur. So there's a lot of things that live in this area, but I'm not really concerned with naming the exact root cause of the pain because by and large it all gets treated about the same. And so next what we're going to do is we're going to go over some of the clinically relevant anatomy of what's going on and then go into treatment. So essentially along the outside of your hip, your lateral side, you have a couple of muscles that all are kind of relevant to us here. So you have your glute med and glute min, which lie on the side here, all attaching onto that greater trochanter. And that's primary job is to abduct the hip like that, to abduct and stabilize. Additionally, you have what's called your TFL, your tensor fasciae lata, which goes from here down and actually attaches into your IT band. And now you can't stretch your IT band. That thing is like a steel rope. You cannot stretch that. However, your TFL is our ticket out of here, out of the pain city. So what you're gonna do is we're gonna work on trying to get all of these tissues calmed down. Because what can end up happening is, let's say those muscles are tight or you have weakness in the side of your hip, that when you're stabilizing that hip, you end up kind of going off to the side. That's gonna increase strain on the IT band and on those muscles that all run over that greater trochanter. And what's right under there? A bursa. So you could potentially have some irritation to the bursa or bursitis, or potentially some tendinopathy going on to those glute med, glute min tendons. Either way, we're gonna treat it the exact same way. Don't worry, focus on doing the work and getting better. What I've done today is I put together some exercises for you, and this is very similar to the way that I treat patients who come in with the same symptoms to me in the clinic. And so at first, we're gonna start out focusing on some reduction of symptoms, reduction of irritability. We're gonna focus a lot on some stretching of these hip muscles around here. From there, we'll move on to reinforcement. And in reinforcing, we're gonna be working on just raw strength and motor control to those lateral hip muscles. From there, we're gonna be returning you to full high level of function with some high level exercises that you can do as a part of your warm up or as an off day activity to help maintain and even progress some of those strength gains that you've made in those lateral hip muscles on both sides. So sit back, enjoy the exercises. Hope you've enjoyed the video. Thanks.